Well, I hope you're enjoying the course. The next lecture in the series is entitled Necrotizing Infections. And you may ask yourself, wait a second, Niezgoda, how about gas gangrene? How about necrotizing fasciitis? Those are indications. Necrotizing infections is not on the approved list of indications. Well, this lecture is specifically built for you as a clinician. When you go in and treat a patient, you're not going to be treating an ICD-9 code or ICD-10 code. You're going to be treating the patient. This patient is going to present with a necrotizing infection. And hopefully by the end of this lecture, you'll realize that this is really a mixed bag of infections. And sorting out gas gangrene from necrotizing fasciitis is really important, but more important from an academic standpoint. From a clinical standpoint, recognizing these infections and recognizing that they should be treated early and aggressively, and the reason for hyperbaric oxygen therapy as part of that formula is probably what the take-home message needs to be for you clinically. And so we are going to talk about necrotizing fasciitis, and we are going to talk about gas gangrene. But hopefully by the time you're finished with this lecture, you understand that these really need to be looked at as one type of infection that profoundly and seriously affects our patient and has these patients at profound and significant risk for death and complications from these infections. And through our early interventions and aggressive interventions, we can prevent much of that mortality and morbidity. So that is why we're calling it necrotizing infections.